Yes, good morning, Dr. Goodman. Many thanks for meeting with us today.
Oh, good morning.
My first question is, could you tell us how long you've worked here at Gould Farm?
Well, I came to Gould Farm about 9 years ago and started working here consulting to the clinical team as one of the psychiatrists. The other psychiatrist who was here wanted some help, and so I joined and started working here to help out. And it's been really I'm so grateful to have had that opportunity and to have fallen into this, because it's become such an important part of my work week to me, and I feel that it's very sustaining to me, that I'm involved in working with this population of the severely mentally ill and seeing them get better much of the time.
Okay, terrific. Could you tell us a little bit about your work here?
Sure. So my job is to help make the initial diagnosis and manage the medications for the folks here, and also consulting with the clinical team about what's going on with the patient now. It's terrific to work in a residential setting where there's 24-hour observation of my patients, and so I get information from the therapist and from the work team and from how they were at dinner last night, and all of that is so useful to try to make sense of what's going on. In other words, if there's some change in someone's behavior, to think about, well, what's been happening for them. Did they have some interaction that was very discouraging or upsetting, or is there something that they're working on in their therapy that's contributing to the change?
Okay. What are several of the most valuable things you've learned during your work here?
Well, I'd say the things that come to mind first. One is how different the mental states of an individual can be from one moment in time in their illness to another. That the range of mental states is so vast for an individual, and I think if you meet somebody in your office for one moment in time, there's so much else about them that you're just not able to appreciate, because it's not present for you at that time with your patient. And so it's been really useful, I think, to recognize how someone who at one point can look so severely ill and impaired, and at another point looks completely well, and really they're a different person. I think also it's been very valuable for me to struggle with when patients don't get better, how heartbreaking, discouraging, and painful that is for those of us who work with them, but of course mostly for them and for their families, when the treatments that we have available aren't helpful. And on the other side of that, seeing people get well when the treatments that are available seem to work really well for someone. Of course, that's what we're in this for, and so that's been very important to me.
Wonderful. My last question, could you give other psychiatrists perhaps several tips on how they can further recovery in their seriously mentally ill patients?
Well, I think that I really have an unfair advantage being in this setting where someone has 9 months to 3 years in a continuous care with a team of people living in a community where there's opportunities for them to work 5 days a week, and be engaged socially with people all the time, and to have that length of time for not only for their brain to recover and for me to help reduce their symptoms with medication, but then to really watch them develop and mature in the way that we human beings are built to grow and flourish. And I think that that's something that often you don't have the opportunity to really see if you're working with somebody in an office, and if there's not a resource like residential level care like this. So I would encourage people to try to seek out those sources of care when they're available, because they can really be so valuable for patients.
This was very heartfelt and very valuable, and I thank you so much.
Oh, you're very welcome.